Okay, so now we have 3 more different categories on the same card. I'm trying to save paper here, y'all. So the first one we have are cholesterol absorption inhibitors. The drug here is izimtamab. I don't know how to say it. Zetia is the brand name. This stops absorption of cholesterol in the small intestine. So the overall goal is to decrease LDL levels, decrease triglycerides, and increase HDL levels. This is for severe chronic kidney disease, and you can combine this with statins, especially when the patient has not responded well to other therapies. The adverse effects include back pain, diarrhea, hepatitis is rare, but it can occur, myopathy, which can lead to rhabdomyolysis, or however you say that. I still don't know how to say it. Nursing implications are that the patient can take this with food, but they cannot take this with a fibrate. Remember, we just talked about statins and fibrates and how statins and fibrates don't play well with others. They don't play well together because of that increased risk of rhabdomyolysis. Well, since this one does play well with statins, it's not going to play well with fibrates. So that's something for you to remember. Okay, the next one is Antisense Oligonucleotide. Again, I'm not saying that right, but I'll show you the information. The only thing that we really need to know about this drug, the drug is mipomersen, which is Kymormo. I don't know how to say that, but it's only used for homozygous familial hypercholesterolemia. So that's the only thing you have to know about this drug. One of our teachers actually said that in her 40 years of nursing experience, I think she's only seen this drug prescribed one time. So it's a very rare thing, but it's just, you need to know that this drug, mipomersen, is for homozygous familial hypercholesterolemia. Just such a mouthful, whatever. Okay, the next drug category, you're going to just remember that it's PCSK9, but it's proprotein convertase subtilism kexin type 9 inhibitor antibody. This is such a mouthful. Say that 5 times fast and you'll be out of breath. Okay, involocumab Repatha is the brand name, which is so much easier to say. I don't know why they have to make the generic name so difficult. Come on now, just make it something easy. You're going to sell it as something easy anyway. Whatever. Okay, so this drug helps the liver clear LDL by limiting the action of PCSK9. So it can be used for patients with diet and a statin therapy. Remember, this one plays well with statins. It does not play well with fibrates. So I don't know. It made me think about that. This drug is given SQ, and the adverse effects are that it can have the patient can experience a hypersensitivity reaction, which would be a rash. And just another thing for you to remember: when you see the drug name ending in MAB or MAB, that means it's a monoclonal antibody, which is essentially the drug is trying to get the body to do what it's supposed to be doing. So not necessarily a reset button, but it's just hey, body, do what you're supposed to do, dude. Get rid of the LDL. Come on now. Something for you to remember. So those are the 3 drugs. Again, there's not too much information to know about them, but really long name, only for this one random condition. And this one is the thing that can combine with a statin. So since it plays well with the statin, it's not going to play well with a fibrate. Very little information, but there you go. That's all you need to know.